So the purpose is that the fluid is going to bathe the nerve root, going through the epidural space, decrease the inflammation, and give you a break from that continuous pain that is interfering with your function. So this is one approach. We call it caudal epidural injection. The second approach is called translaminar approach, which is directly from the back at a higher level where the pain is, where the disc is herniating, close to that translaminar. Now in translaminar, there is a chance that the needle tip can get into the thecal sac where the fluid around the nervous tissue. If that happens, nothing big is going to happen, but you may feel severe headache and you might feel a little dizziness because the medication is directly now going in the thecal sac. The idea is if you feel that, the doctor should not inject there. Similarly, the third approach is transforaminal approach, which is on the side of the spine. There are keyholes through which the nerves which are exiting the spine exit from that foramen. So between the foramen and when they are just exiting the nervous tissue, they have to go through epidural space. Now this is technically little more challenging because the fluoroscope or the specialized X-ray machine has to be exact when you put the needle, because your needle tip is very close to the nerves and it can even touch the nerve, which will be very painful. And since you are not fully sleeping, you can let the doctor know that you are feeling pain going down in your legs. But most of the time, even you feel something when it's going, because the doctor moves the needle very in small increments and seeing the needle in the safe place just below the pedicle or just above the vertebral end plate. So there is a safe area. In either case, you can avoid getting into a vessel or into a nerve. And once you put the contrast can flow in the epidural space and along the nerve root. And here you don't need a big fluid, you need a small fluid. So three approaches: the caudal, the interlaminar, and transforaminal. Out of these three approaches, transforaminal approach has very strong result, very effective result. However, when the pain is coming from multiple area, it's not possible to go to different areas. So the caudal approach is the first approach, and then later on, whatever is left, you can use a transforaminal approach.